Let us start with making a protocol today, and at the end of certification course, all us requested to submit research protocol. Now, although there are so much detail in this PPT, our concentration is on material method. So, first step, you should have a determination that you would like to complete one project proposal in a span of maybe a 1 month or 1 year, whatever may be your feasibility. And it will be better if there's a group of 4 to 5 people together if you take a project proposal. Now, the first step, when you meet 4 or 5 person, let's say a team of 5 person, the all 5 of you should be preparing the list of problems around you, whether it's a medical problem or other problems. List of problems you should prepare. So each one of you will prepare 10 to 20 problems. Then all 5 of you will sit together and find out that what are the common things that you would like to uh, address. So out of five students or the team members, there may be 50 to 100 problems. Then you ask the question that which you can finish within the time period which you would like to devote, or how much finance available to you, or what is the need of that the problem, or is this problem affecting large number of the people, or is it possible for us to solve this problem? So based on this criteria, right, your institution will allow or not, whether there is ethical clearance will be available or not. All these questions you will be asking, and the list of the problems you should be putting on first column in Excel file. Second, third, fourth column onwards, you will be making a heading. What will be the budget, the manpower required, the population which you would be doing? Is it possible? Will they respond or not? Sample size which you take, that is visible or not? The resources you require, time period available. Then the technology which is available to you or not to address that problem, whether the solution will be possible or not, and the solution will be long lasting or short lasting. People participation will be there or not. Ethical clearance will be there or not. All these 10, 20, 30 points you should be putting on the uh, first row. That means header of the each column. And then against each problem, you will be making a score out of that. And then based on the total, you will be selecting the questions. I will just give an example how to do that. So let us have, we have an Excel file. So here there will be a code number or serial number, then the problem details. Then you will have a five team members, suppose. Team member number. Who has written this? Team member number, right? Code number, problem details. Then uh, how much period it will take? Population affected. Affected. Then there will be resources. This way, there will be, suppose this is a team member number A. This is the first problem details, malaria prevention. Period to require, let's say, around 1 year population you want to cover, let's say 20,000, and this is feasible or not. That also you need to think over. Resources you have or not. Uh, the resources required would be 3 lakh and like this. So then the if you want to make a total of it, then you need to give a score as per your likings. Score to score. Now this giving a score will be based on your feasibility. Suppose you want to do it in 3 months and this takes 1 year. That means score you will give less to it. If it is possible to do it in 3 months, you will give 10 out of 10. But it takes 1 year, you give less mark. Let's say 4. Population covered minimum requires 20,000, but you are possible that you are okay with only 2,000. Then again, low score of it. Then resources. You have, let's say, 20 lakh resource with you, but this is costing only 10 lakh. Give 10 out of 10 marks. So score will be if it is more suitable to your need or it's convenient to you, then give more score. So that at the end of this, total score will tell you whether you would like to do it or not. Such 30, 40 criteria will be there, which we will be discussing that whether we should do the, for example, sampling technique is possible or not, whether people will respond to it or will people will cooperate or not, whether how much involvement it is there, whether someone is doing it or not. Or government is already doing it effectively, then why do we do it? So all these points will be there. And out of such 40, 50 points, at the end of this session, you will have the at least you will be able to find out uh, around 3 to 4 more important things. And then among 3 or 4, you can further discuss. There's another method probably which we have seen could be like this. It could be the topics like malaria, then there's a malnutrition, then you have a topic like the anesthesia, something related to recovery, etc. The same 30, 40 problems which you have selected, out of that, 4 or 5, or maybe at the most up to 10, 10 you can select and you transpose that. Once you transpose it, then there will be a 10 such things over here and 10 such things over here. Then what will be done? You will, this is not to be, this is the same thing. So you will not, and forget the rest of the upper column. So here you will say malaria and malnutrition, which you like more, you say malnutrition. Malaria and anesthesia. Team would like to concentrate more on malaria. Like this. So you will have 10 over here, 10 over here. 100 cell minus 10, that will be 90, 90 divided by 2. So 45 cells you need to fill it up as per your gut feeling and discussion. So that will be the direct assessment of the selection of topic, and this will be the scientific method of selection of topic. When you cover both the things together, then your final question will be selected. Now, so the first thing will be you will be making a group of 5 person. Then you will be selecting the topic as we discussed. Once you select your topic, then these are the headings which you should be undergoing the headings. So once we have seen this heading, so will be more concentrating on the material method. So study setting, where you are going to do your study. So whosoever present today, I think there are three participants are there. I request all the three persons to first discuss about the topic over here. If you do not have any topic in mind, we can discuss and we can give you. Because based on thought in the topic, you should have your pen and pencil or pen and the paper to note down the points right now. At least three project proposals draft should be ready today at the end of the session. And then next time we'll be helping you to make a Google form, collect the data, and do the further analysis. Now, so Dr. Panuganti, can you tell me your name of the topic and write down somewhere so that we can start rest of the discussion?
Sir,
Sir, can you say your topic, any topic you have decided? And if not decided, then we can decide right now, at least tentatively, so that the further discussion will be much easier and clearer. Assam Mahmood, have you selected any topic for
sir,
research? हाँ यार
sir,
हाँ हाँ बोलिए.
serum magnesium in myocardial infarction, sir, acute myocardial infarction.
Okay, you want to find out the level of serum
Magnesium
magnesium
in
level
acute
in
myocardial
acute
infarction.
viral infection. So, and you have something in mind that deficiency leads to myocardial infarction or myocardial infarction leads to deficiency. Any
Myocardial infarction leads to deficiencies.
acha leads to deficiency. So we need to postulate that before myocardial infarction there was no magnesium deficiency, and after myocardial infarction there was magnesium deficiency.
Sir,
So, tentatively, who are likely to develop uh, acute myocardial infarction, those population we are supposed to find.
yes, sir.
Maybe the population from or the hospital, etc.
Sir,
And then we need to do pre and post. And let's have the topics, and then we uh, let us have that topic in mind, and then study setting, etc. will be moving further, right?
okay.
Now, about Assam Mahmood, you have selected any topic? Yes, please. Assam Mahmood, have you selected any topic? If you are not selected, you can tell me your designation, education, so that I can suggest you. Assam Mahmood, are you listening? Yes, please. Can you tell me what is your topic? Yes, please. You spell out your topic, please. Mm, you are unmuting and muting. So keep unmuted. Somehow its net connection may not be right. Nikhar, can you tell me your topic? Because without topic, it will be difficult to discuss.
Yes, sir. Just a minute.
Yeah. So, what is the topic?
Sir, Like I am in the starting of second MBBS, so I have not selected a clinical topic or a subject related topic, just a awareness awareness survey.
Awareness survey is okay, but whatever little you do it, try to make an impact in the society.
Yes,
Even if it is awareness survey, the topic for awareness
sir,
and
the topic that I have selected is myths about menstruation in nursing students, in female nursing students, the ones who are in their final year of nursing school versus the ones who have recently joined. So it will be a comparison of how their knowledge has changed during the course of their learning.
so it will have two kinds of thing. First year nursing student you ask today, third year also asks, and hypothetically, after 2 years, again you ask the first year student who comes into the third year, hypothetically. But because it is not feasible, you will be taking two groups, first year and third year. But when you measure their awareness, also try to see that at the end of the awareness, you provide them some material so that once you ask questions again after 1 month or after 3 months, you can see some changes in awareness level. So if you do that, that will be more useful, right?
Yes, sir.
So measuring awareness alone is wasting your time, wasting their time. But if you have something in your mind, or based on the awareness, then you can decide which kind of intervention you would like to do it. Now, let's say we have two topics in the group and move ahead. First, we move ahead with the Dr. Panuganti. At the same time, you can also write down, and if there's any confusion, you can spell out. So, first is study set. So, study setting could be a hospital, college base, or it could be community based, or in the school, in the college, in the industry, or it can be in the islands, or in the slum area, in the urban area, rural area, whatever it may be. So study setting means in which population, where is your population base, that you should be asking. Just a minute, I take a break for 1 minute. One minute. So So one thing is a study setting. And as far as possible, at the end of discussion, we should see that if the same study is possible at other areas, other hospitals, other communities, other countries, other states, etc. Or you can conduct a pilot study first in your settings and then you will be doing somewhere else. Before you start your study, naturally you should have read a lot about from the internet, etc. and found out that if someone else has done it, still is it necessary to do it again? Yes, if you find a lot of advantage of doing it, as well as there is a possibility that it will change the scenario in the community which you are going to take or in the individuals which you are going to take. Now, the next thing is study design appropriate to objective. Now, in the magnesium case, what will be the study design? It will be the pre and post, right? And you will be following them. So it will be the basically the cohort which you are going to follow them up. And the cohort will be those you can say that those who are coming to the OPD and likely to have myocardial infarction in future. That you can you spell out myocardial infarction or myocardial ischemia. Sir, can you elaborate?
Sir,
Hmm.
myocardial infarction occurs in a acute setup, sir. In emergencies, the patient come with EMD, with chest pain, very
Hmm.
high, sir.
Okay, okay, good. So, Dr. Sayyid Isam Mahmood also said the third topic is topic colorectal cancer screening practices and perception among the general population of the northern region of India. Good that we have third topic also. So keep that screening practices in mind, right, and perception. So, uh, as far as study design is concerned, they for the Panuganti would be it will be a cohort of the patient who are likely to develop, irrespective their magnesium level is low or high, irrespective of that, you are going to do the study and follow them. Let's say you have will determine the sample size. Let's say we want to have a 30 or 40 or at the most 50. 30 to 50 would be sufficient to compare the standard error of difference between two mean as far as magnesium level is concerned, pre and post. How much is reduced? So that number of subject to get 50 patients of myocardial infarction, you need to have, let's say, around, you need to find out prevalence that out of 5,000, how many develop. So if you require 50, you have, let's say, 10% probability over a period of 1 year or 5% for over a period of 1 year or 2 years. Your study period is 2 years. Then you can go ahead like that. But you have only uh, 500 patients in a year, and there is chances of only few patients getting 5 or 10. Then also you can conduct a study. But in that case, you then need to devise a method of analysis in which you will be using a non-parametric analysis. So simple size will be, although statistically you require 50, 100 like this, and but feasibility is not there. Then you can reduce your sample size and go for non-parametric analysis. As far as Sayyid is concerned, uh, he wants to do two things. What kind of screening is going on in the population and what population is believing about it. So now, initially, he should do a pilot study. It is a population-based study. It would be a cross-section study. And uh, he need to understand from where he can get this data. So I have today shared you around 5 files. You can refer to the biostatistics revision. In that way, the source of data is given. So you refer to that and find out that in your population, North region, from where you are going to get this data. It could be community-based data, or who is going to do colorectal screening? Doctors are doing it, for example. Then you catch out of the doctors who are doing it, ask them that how frequently you are doing, then also you can get a data rather than going directly to the population asking the question. So his method would be a cross-section study, right, in a population. Then comes the Nikhar. Nikhar is going to do pre and post interventional study in the nursing students. So that comes about study design. Now, uh, the sample size. Nikhar should have approximately, the classes will have 50-50 nurses in each class. That will be sufficient for her to compare.
Sir, she is not interning, sir. She is only
Uh,
studying students first year to final year. The observation study, no, sir.
yeah, observation study,
Intervention is not there.
but I'm presuming that I advise her that you should do even though she is in second MBS. It is
Sir.
not difficult to find out a material on the menstruation, maybe PPT and educational tool, so that after the pre-test is over in both the groups, she should share this material with them, and after 3 months or so, she can again evaluate that. And I'm here to support anyone in the India. I can talk to her teacher, her principal, etc., to help them. And I can also find out the material to distribute. So that, see, if we do only the awareness study, it has absolutely no value. There are lots of things going on around the world. We want to make a change in the world so that the society improves. And suppose if it is not feasible, we can give her backup. That she forgets after awareness, but then there could be a team of interns, doctors in the Sola Medical College where she is studying, and one or two interns will be involved in the study. And I can persuade few interns so that a team is there to carry on this. Our topic is selecting, and that's why I say the team of 4 or 5. If we build a team, we'll have a very good work, and the outcome will also be good, and frustration will be less. So that should be the thing. Uh, and now the study subjects, all the three groups. In the your case, it will be the patients, right? And occasionally you can include if volunteers are available. Those above age of 60 years, of course, seemingly seems to be healthy, but then they come for the routine health checkup. From there, their magnesium level you can find out, and then you can follow them up over a period of 1 year, 2 years, 3 years, like this. So from routine health checkup, this is done in the industries, in the sometimes the staff of the colleges, or sometimes the as a part of a group like a huge group, like Torrent or the Kedila, etc. So if they have the screening data available, we can use that. And naturally, after they have acute MI, that data will be accessible to us. So pre and post data comparison becomes easier. So selecting study subjects. So the population is very, very important for you to define. And uh, not only patient or in the committee also, you can select few people. So depending on your the team number, you can say you would like to do committee based, industry based, or hospital based. Right now, we are going hospital based, right? Now, as far as the definition is concerned, based on inclusion exclusion criteria, that you can definitely decide as per your uh, study. For example, age. Your age will be how much age you would like to keep, or male or female, etc. And then also you can think of the hospital setup, right? So which OPD. For example, unit A, B, C, D, there are 4 units, and we include 2 units only as per the uh, what feasibility, right? And then the patient are willing to get a follow-up or not, whether they are agree or not. And if they want to disagree or they are coming far rural areas, it is very difficult for you to follow them up with any method, even mobile phone not accessible, etc. So based on that, you decide inclusion, whom to include and whom to exclude. Now, before you go for sample size, the word prevalence estimation, factors detection, these points will be going into detail. All the three persons should decide their population. And uh, for example, Nikha has decided the population or one the nursing college. She can think of even 50 nursing college of India. Not now, later on. This is hypothetical, I say. And this 50 nursing college will be randomly selected out of 10,000 nursing college of India. That is one thing how you can go ahead. Right? As far as the Dr. Panupati Ganti is concerned, you can have, let's say, in your state, let's say 100 hospitals out of 30 or 20 hospitals you are selecting by systemic randoms happening like this. And this population is concerned in case of Dr. Sayyed, would be, let's say, he wants to do in rural area, urban area, and then in both the area, you can say that in a urban area, he will select the wards, and from wards, the societies, and societies, bungalow. And in the rural area, we'll select some villages, and then villages, some streets, and streets with few houses. This kind of multiphasic, multi-stage sampling technique can be thought of in your cases. And otherwise, you have defined population. The population, when you use a word, hospital population is not a word for you. The patient more than 50 years age attending the medicine OPD in a particular hospital between this date to this date is the population for you. And from that, suppose you want to include all the cases. then there is nothing like sample size. It is only the population which you are selecting, and all the patient fitting to your category you are selecting. But you say it's a very huge number, 5,000, then every 10th you can select, right? Fifth, 15, 25th, like this. So you should have a sampling frame. You should have the sampling technique. Usually, systematic random sampling becomes the core, and that's the easiest method for you to. Then the how much sample size is required? Usually, for any study, the 400 sample is the ideal if you want to go into the detailed analysis. But then, in such cases, the around 100 would also be sufficient. And as we discussed, sample size you can determine by n is equal to 4q upon s square. This p and q, if you know that it is a 10% or 5% of the population, in that case, you can apply that. Otherwise, P and Q, you both take as a 50%, 50%. So, 15 to 15 to 4, it will be 10,000 divided by L square. Now, L square is a range. How much you want to have, right? L square. So, you want to have plus minus 5%, plus minus 2%, like this. If you want to have plus minus 5%, then 5 square is 25, and 10,000 divided by 25 will be a 400. So usually that's what people come to a conclusion about 400. In case of Nikah, it will be number of students available in both the classes 50-50. Sir Dr. Banu should develop it, how many patients are available, and the population wise, the Dr. Sayed will have a challenge because to find out in the population is a huge population. That's why if it is better if it goes through the doctors who are doing it. So doctor, you may not find out 400. Doctor maybe on 10 or 20 or 30 who are doing colorectal screening. So it will be better to approach all these 30. So your sample size would the population would be the doctors whom you are asking, and sampling will be the list of doctors available. Either you can ask all the 30 or all 3 or 10. It all depends how much screening they are going to do it. And in the population directly, if you want to do it, whether you have undergone screening or not, it's a very, very challenging. And for that, you should be using lot sampling assessment, whether people go undergo that or not, how much population is covered. So lot sampling technique will be much easier, can be done faster, but it will tell you only how many percent of the people are undergoing the screening. But as far as the general popular perception is concerned, it is not that difficult. That you can have an adult population age more than 40 years. You can define the cross section study. You can do it, and every 10th individual or every 10th house aged more than 50 years, you can just ask whether you have done this kind of thing or not. And if you want to, if someone comes to you, would you like to will you allow or not, whether you know it about or not, such kind of awareness study, you can do it. So depending on how you want to proceed, your population will be defined, your sample framework will be defined based on that, and sampling tech. And samples have already been discussed, right? And the other reason is factors detection. What you want to detect. So, suppose it's a very rarity. If it's a very rarity, like a cancer case, then if it is your prevalence study, that how many people are having this, then you need to take a large population for screening purpose. And then you can find out the prevalence of that. And the procedure of data collection, you can start doing. I have shared a file on the questionnaire, and that questionnaire file will tell you how to frame a question. So you can start making at least you should have minimum three parts of question. One is identify, name the patient, etc., which you will not be going to give to the statistician for the purpose of analysis. The second is basic data like age, gender, etc., area, which you would like to remove the confounding factors. And third is core study. a core study and the variables regarding core study, where you say the input variable, the variables which can cause, which can have this particular output, right? So magnesium level, in your case, the ischemia, the acute myocardial infarction is input variable, and magnesium level is the output variable. Such things or duration also you can have the how much duration acute see magnesium level immediately after some time, like this also can be considered. And so these are the things which you should be writing as far as material method is concerned. Now, before I proceed, you can ask any question concerning your study, and then we'll be going for next step. Any question?
Sir, usually in the studies, the age of the patient, usually they say 18 years, sir. 18 years to say 60 years, 70 years, like that. 18 means why it is because the adult person, what is that, sir? Is there anything in the concern with the fixed 18 years age?
See, because the person can give consent by themselves.
Okay.
If some study is regarding children, for example, you can take even newborn also. So
Okay.
nothing like that. It's not that 18 years is necessary. But if you are directly asking the question, taking consent of the patient, then the person should be adult. That's the only thing. But in colorectal cancer, I would suggest that to find out the literature, usually where is the onset. If onset is let's say usually 45 years, 50 years, then you can minus 5 years for lifestyle, etc. 40 years like this, right? But there's no need of including 18 years up, because see, all these people have a lot of problems at a various age group. And as far as lifestyle is concerned, yes, from childhood you should be talking about the colorectal cancer. But then the society, the way it's going fast, and there are so many points to be considered, it is better to target a particular age group. So it will be better if you take age group more than 40 years or something like that. And the about Santini just joined. Have you decided your topic, Shantini? Have you decided your topic? Any question on which you are going to work? Because we are discussing how you are going to say, do the study. Have you decided? Okay. Till she gives answer, we proceed further.
Sir, I have not decided still, sir.
What is your designation?
Sir, I'm an anesthetist, sir.
Anesthetist, yes. So you had shared some of the concern how you are going to what you can do it, right? Simple study of let's say the various anesthetic agent use and the effect of anesthesia, or between the different anesthetists, what is the outcome of the patient? In your hospital, suppose you have 10 anesthetists are there. So type of anesthetics, a level of experience, and versus the duration of the type of operation, recovery, something like that. So you can see such study. And if you want to say pre-anesthetic counseling, post-anesthetic result, patient might be apprehensive, etc. So how the counseling was done, you can take a video shooting of pre-anesthetic counseling. You can analyze that qualitatively, that what kind of difference it makes. Because apprehensive patient may make you more trouble during anesthesia, even though you are experts. If patient is a relaxed one, then it may be a less problem. So something like this, you can try to do it, right? And
Mm,
now,
yes.
this we had discussed. So the type of study which we are going to take, right? So the prevalence of the disease or prevalence of the knowledge, etc. that Nikhar can come on the prevalence of prevalence of the knowledge, or I would better if she can go for intervention, that will be the better thing. And looking for the prognosis, right? The whether the magnesium level is reduced or not by the heart attack, that we can use the word as a cohort study. And the Dr. Sayed, it can be a cross-section study, right? And the anesthesia part, for example, that depends how what kind of selecting the subject. The sampling technique, mostly you will be going for systematic random sampling, unless at a population base, if you are going to take a large study, it could be a cluster sampling also. In cluster sampling, you are going to take 40 clusters in the population, and in each cluster, you will be going to take six individuals of your choice, of not of a choice, but six individual which fits to your criteria. So 240 people you can select in the population and can find out what is going on. And the sampling frame you should be preparing, right? And these sampling frames, sometimes if it is a population-based study, it may not be possible for you to making a whole sampling frame, but at least sampling of units you can have, from which you will be selecting units. Now, variables. You should have your input variable and output variable. What are the, or you can use the word independent variables, and then on that, the dependent variables. That kind of things you can do it. And the data analysis, in which you will be doing descriptive analysis, that how many patients you have taken, what was the percentage of a difference, gender wise or study wise, or you have asking a particular question whether the hygiene was proper or not, yes or no, what was used or not, like this, you can get a percentage. But if you have something like mean duration, duration which they are using a particular method, etc, in a colorectal, with the people understand or not, yes or no, that you will get a percentage like this. And then based on this, you can compare. If you have is a cohort study, then you will have the relative risk. If you have the case control study, you can have odds ratio. Chi-square can be applied in both the group. And multivariate analysis, you can do it if you have many variables together and you want to find out the effect of that on outcome. Now, this budget part. So, if you're going to write to ICMR or to a funding agency, keep the budget of at least 20-30 lakh rupees. And if you're applying to your own institute or the individual donors, then keep a small budget of 10,000, 15,000 like this. For example, Nikhar can have a small budget of 15,000, 20,000, etc., which he can get from the startup fund, which is already 50 lakh allocated to the Solar College. But if she wants to do a better in future with, as a part of team, it could be 30, 40 lakh rupees. And you can take up a challenge that all Ahmedabad college girls will be educated and the change will be done. So, in case of the by the Dr. Manu Ganti, also, because you are taking a very vital things, in that case, it is better if you can uh, involve many hospitals. So, it first make a pilot study budget, apply to the local bodies, and then based on that, make a big budget. Right?
Okay.
And as far as the Dr. Syed is concerned, uh, the community-based studies are taking a lot of money because you need to have transportation, engaging the people, etc. So you decide your budget, but usually go for 40, 50 lakhs of budget and apply to a bigger institute. So I think um, the analysis, you should be able to, I will stop this over here. You should be able to do the analysis by yourself, or in your team, someone should be uh, mm, Nikha say no budget required with nursing college. Even if you, Nikha, do not require any budget, you should try to write down, right? Because manpower is utilized. You yourself put your manpower. You going to use 10 hours or less than 40 hours on this study. Per hour, you should get let's say 200 rupees. Put it. Try to learn this. Learn to write a budget. It's not that difficult. Headings are there. Whatever you want to write, write it. Right. So, because when you go for a multi-syntax, if someone else wants to do it, all people may not be so motivated. So now, before we go towards the end, each one of you, suppose actually you're going to start the study in your place, and you would like to first do the pilot study, and then you would like to collaborate with the rest of the world. So, any question?
I like to take up this BP recording, sir. Three observers, three types of BP apparatus.
That will be wonderful because hardly anybody is
Yeah,
doing
yeah.
such kind of study. And it's so important because nowadays the BP instrument are going to be get converted into the electronic, which is really hopeless things, right?
Yes,
Which measures sometimes inflated. Even in the tertiary care hospital, I don't want to like the name in Ahmedabad.
sir.
Just I admitted my wife for a very short time, 1 or 2 hours, because of suspicion whether she may have a myocardial ischemia or not,
Sir.
chest pain, etc. The BP recorded was 230 by 130, something like that.
Sir.
So fortunately, we had our own BP instrument there, and we measured with that. It was absolutely normal. So
Okay.
such kind of things are really is a havoc. So either person is doing mistake or instrument is doing mistake. How do we know it?
Yes.
So actually, when we were students and also young medicos, we used to do the standardization of machines very religiously. Even if you want to measure the height of infant, we are going to use infantometer, but we'll do this kind of standardization. And then only we go to the field with this infantometer. So I think it will be a great service to the students and teaching faculty and the students if you can initiate at least some kind of standardization of the instruments. And
Sir,
I will be here to help you in analysis, etc. Any other question?
unfortunately, due to mercury toxicity, sir, and
Yeah,
mercury BP apparatus are being kept aside, not being manufactured, sir.
yeah,
Yes.
that is true. But then what happens that there is something like the people says ISO standard, etc.
Hmm.
But then nowadays there are very good sensors are available, right?
Hmm.
So what I would say is the measuring the pulse. So you keep your hand on the pulse. Similarly, there are around 27 small sensors kept on the pulse directly on the radial artery, and that also can be measured. So there has to be some kind of cross check should be available with us rather than measuring only with the digital BP instrument. Otherwise, the future of the mankind is going to be worse because BP. So many patients are given unnecessary treatment of the blood pressure. And the moment you tell the patient that you are having high blood pressure, that's all.
Yes.
That word of the doctor itself is sufficient to cause blood pressure in the patients,
Damage to the
even if it
patient.
is not there. Even if it is not there.
Yes, sir. Yes, sir.
Same way with the diabetes, blood sugar, etc. So I think the blood. I would not say that the mercury number should go forever in the mankind. But then when you want to replace it, you do the standardization at various places. And if you consistently find that 99 out of 100 instruments are okay, and the one instrument which is hopeless, that was possible to evaluate by the doctors. So it should be nice, it should be 100%. But if it is an error, yes, it should be detected. And in normal individuals, that instrument should be used at least twice or thrice in a day, so that to check whether it is showing much higher or not. That should be there. So with a newer, the standardization of electronic instruments daily is a must. Even I would say the weighing machine. You should have 5 kg standard weight with you, 5 kg, 10 kg, 15 kg. Your electronic weighing machines, you put it at least once in a day and find out whether it's true or not.
Yes.
So today it seems to be a hypothetical, but tomorrow it has to be a practically implemented everywhere if you want to improve the medical care.
Yes, sir.
Any other any other question? So the next time I think should we have on Tuesday, I think before we start on Tuesday, at least start making Google form. If you do not know how to make a Google form, you can learn from colleagues on the net like this. It's very simple. Right? So you start preparing Google form, and if 1 or 2 days prior it is ready, we can help you in someone else also filling that form.
Google Form
If
for
not,
what purpose, sir?
for collection of the data,
Oh,
because data collections should be there. Of course, you can do it in Excel and then do analysis in uh, the AP info. But I presume that if you prepare that, if someone else wants to collaborate with you, it will becomes much easier. That's why the uniform format could be there. In your case, you can take help of some resident doctors or some juniors like that.
okay.
Any other points? So in statistics also, if some points are left out, for example, you want to have a repetition. I would say the kappa score requires a repetition. Lot sampling analysis requires the repetition. If you need some such topics, AP info analysis, I will be definitely doing next time. That at least you should, all of you should do now AP info analysis. And please remember that it is not that only you can attend this, right? While I teach, your colleagues can also, you can share them link and they can also join.
No.
And
Sir, survival analysis, sir.
hmm? AP,
Survival analysis.
AP info analysis with AP info.
Okay.
And from 1st December, we'll be starting another batch, I think 25th batch. And uh, if you find that some of the students may not be able to pay the fees, we are not eager that everyone should do that, right? But more and more people should join this venture so that better research outcomes comes. So yes, sir wants to do about Google Form. I will share the link, right? That you can start, click it and start preparing Google Form. It's only a 10 or 15 minutes job. Else, I will be teaching just 10 or 15 minutes before the session start because so that everybody need not spend time. Any question? Oh, so let's close it, right? We'll meet on the next Tuesday, and I hope that data collection can be started at least from Friday or so before we end over this lecture series, etc. Thank you.